Is low-dose aspirin safe for hypertension? Are you wondering if low-dose aspirin is safe for those with hypertension? This is a common question, especially for individuals looking to manage their heart health. Let's break it down together. Low-dose aspirin is often used to lower the risk of heart attacks and strokes. For people with hypertension, it can be safe, but only if their blood pressure is well controlled. This means that if you are managing your blood pressure effectively, low-dose aspirin can be beneficial. Research shows that taking low-dose aspirin, usually around 75 to 100 milligrams daily, does not significantly raise blood pressure. It also does not interfere with blood pressure medications. In fact, it may even provide extra protection for the heart in those with high blood pressure. However, there are important considerations. If blood pressure is not well controlled, the risk of bleeding complications increases. This includes serious issues like gastrointestinal bleeding or bleeding in the brain. Therefore, it is essential to ensure that blood pressure is managed before starting low-dose aspirin. Clinical studies, including the Hypertension Optimal Treatment Study, found that low-dose aspirin can reduce major cardiovascular events by about 15% in people with hypertension. This is true as long as their blood pressure is managed properly. The key is to balance the benefits of aspirin with the potential risks. It is also important to note that low-dose aspirin is not a treatment for lowering blood pressure. While some studies suggest that taking aspirin at night might have a slight effect on blood pressure, it is not a reliable method. Standard treatments for hypertension, like thiazide diuretics, angiotensin-converting enzyme inhibitors, or calcium channel blockers, remains the primary options for managing high blood pressure. In summary, low-dose aspirin can be safe for those with hypertension, but only when blood pressure is well controlled. It should be used to prevent cardiovascular events rather than as a method to lower blood pressure. Regular checkups and consultations with a healthcare provider are essential to ensure that the benefits outweigh any risks. Always discuss with your doctor before starting any new medication, including low-dose aspirin, to ensure it fits your health needs.